meaningful with their families and their communities. Similarly, social workers, we also have to be concerned about our own self-care in these times. And I know some of you may have not been able to work at your job at all, or maybe there's a switch to working online, or many of you maybe still be working in person, face to face. And there's lots of concerns about how do we protect ourselves and our clients when we're supposed to be putting ourselves at a distance from our clients, but we're in situations where we really need to be with our clients at these times, and we need to figure out how we can manage the risks around in-person communication with people. Third point talks about community concerns, and so we have to look at what's going on at political levels, what's going on politically at the federal and the state levels, but also what our individual communities are doing in terms of encouraging different types of behaviors around isolating ourselves, keeping at a distance, doing things to, as they say, flatten the curve so that we spread out the number of people that are being exposed to COVID at this time, hopefully to reduce the pressures on our health system, and hopefully to give many of us time to actually have a treatment, or perhaps even some sort of prophylactic, a type of vaccination, so that many of us are not actually going to contract this COVID virus. One of the things that's come up for social workers in terms of law versus ethics is, we have not changed the code of ethics since the pandemic started, but there have been some legal changes, and we have to figure out how those legal changes have an impact on what we're not only allowed to do, but what we should do as practitioners. So one of the things that's happened for mental health professionals, including LCSWs, is that under HIPAA, Health Insurance Portability and Accountability Act, they've created some exceptions, some reductions in the way that that some of the HIPAA laws are going to be enforced. So they actually didn't change the HIPAA law, but there was announcements. It was a regulatory or an administrative decision that they're not going to be as tough on enforcement when it comes to the different types of uses of technology. So previous to this announcement, if someone were to use a non-HIPAA compliant method of communication with clients, maybe using Skype, maybe using regular email or regular texting on your iPhones or your smartphones with clients, that would be considered to be a violation of HIPAA, and there could be enforcement mechanisms, fines or restrictions on people's practice if they make use of those methods. Given that there's a pandemic, given that not everybody is prepared for this pandemic and able to access all of these different forms of communication technology that are HIPAA compliant, they are not going to be enforcing those strict rules around what types of communication technologies that you can use with clients. From an ethics perspective, even though the law is now permitting us, in terms of enforcement, to use these other types of technologies, still, wherever possible, ethically, to protect the interests of our clients, including 1.07, the confidentiality of our clients' communications with us, it's still better to use HIPAA-compliant technology when possible. But as we'll see in a number of the cases that I discuss, there's a lot of situations where our client doesn't have access or doesn't have easy access to HIPAA-compliant technology, or you may have other professionally compelling reasons to not use HIPAA-compliant technology to communicate with clients. And so you'll know that ethically, it's not perfect practice. Legally, it's being permitted, and you'll try to do whatever is the most prudent under the circumstances. So for example, each of you are listening to me on this teleconference today, not from my regular office, but from my home office. In order to reduce the risks that people may hear what I'm sharing with people, although this isn't really a confidential discussion, it's really open to the world through the web anyhow. But in my own practice, in my talking with students, in my speaking with clients, I'm making use of headphones so that nobody in my house can hear what other people are saying. I'm keeping my door closed, and I'm asking my husband and my daughter to stay away from my room when I'm communicating with clients or when I'm communicating with others, when it may be a confidential situation. Is it perfect practice? No, it would probably be better if I could communicate from a completely separate office, but I'm trying to do the best that I can. Am I going to have some interruptions? Well, you may hear my dog bark. I've tried to take care of him as best as possible, but he's kind of like a 2-year-old with very poor boundaries, and he always likes to, come in and talk to me and bark at me if I'm not giving him um, enough attention. So I'm trying to do the best that I can, but it's a less than a perfect situation right now. So one of the things that I wanted to talk about just in terms of our terminology, right from the beginning of the recognition of the pandemic, people have been using the term social distancing, saying that people should maintain a distance of about 5 or 6 feet apart, because we know that one of the ways that COVID is transmitted, the most common way is for it to be transmitted by any type of um, going to say spit, but coughing, any type of moisture that's being transmitted between people. We know that the virus is not just suspended in the air; that it has to be part of a part of a substance that includes some liquid or something that it can glob onto. And so, if somebody coughs, we know that generally the material that they're coughing is going to fall down between 5 and 6 feet. So if we keep 6 feet apart, then we're reducing the chances that we can um, communicate that disease to one another. I'm going to encourage the word term social distancing, physical distancing rather than social distancing. We can socialize, we can connect with people in many ways through the internet, through I've seen people talking to their parents from the street, speaking up to their parents on balconies. There's all sorts of social networking, all sorts of gaming, all sorts of ways that we can communicate with each other. I talked to my neighbor over the fence like they did in the TV show Home Improvement. So we can socially connect with each other, but still maintain that physical distance. So we need to ensure during these challenging times in particular that people are not socially isolated. We know that social isolation actually has a negative impact on people's immunity and can make the ability to contract COVID and the ability for the body to deal with COVID much more difficult. So social distancing, no. Social connection, yes. Physical distancing, yes. Now, there's a number of different issues when we talk about communicating with people at a distance using technology. Um, Number one, our primary commitment is to our clients. And so there are occasions where we may need to put ourselves, our own comfort at risk for the benefit of our clients. That doesn't mean that we need to put ourselves in undue risky situations. Each of us, our agencies, the places that we work, the agencies that regulate our work, will provide us with guidance about what types of contact we may have, could have, should have with our clients. Um, Many of our clients are in particularly vulnerable situations, and so we should reach out to those people in particular in terms of making sure that folks are okay. Um, and again, this can come across in a number of different ways in terms of what's appropriate ethical practice. Some of our most vulnerable clients may be the ones who do not have access to a computer or do not have access to the internet in their homes. And so we need to figure out what types of services that we can provide to them, even if they don't have these types of technologies available to them. In terms of the second point, self-determination and informed consent, it may be possible for us to use a telephone, or it may be possible for us to use Skype or texting or even HIPAA compliant technology such as Doxy.me or other video conferencing technology to communicate with the clients that we're serving. But we should ensure that clients have rights to self-determination and informed consent, not just about the type of intervention that we're providing them. It's not just explaining that I'm providing CBT or I'm doing narrative therapy, but also proposing different types of communication technology with them and seeing what their preferences are, going through what the positives and the negatives are. I might be working with a youth who feels most comfortable on texting. So I should have a conversation with that youth and perhaps even their parents. Is it okay to use texting for things that may be sensitive? What are some ways that they can reduce the risks around texting? So if they're sharing a phone with different people in the family and they have a text conversation with you, make sure that they're deleting that text conversation and also deleting any backup to that text conversation. Is it perfect practice in terms of minimizing all the risks of confidentiality being breached or unauthorized access? Absolutely not. But if it's a choice of texting or no communication at all, or very limited communication at all, it may be much better that we engage the person through text messaging than do nothing at all or have something that's less satisfactory. I'll pause for a moment and see. Sarah, are there any comments or questions that I should be responding to now?
We have a couple of questions. I will start with this one first. We have one question about phone visits. We have patients that do not have computers or smartphones. I also have some patients that do not want to do video and prefer to talk on the phone. This is regarding Medicare requirements. You've covered some of that, but I don't know if there's more that you want to say about that.
Okay. So one of the points later on that I would discuss is the issue about insurance and reimbursement. So let me put that point up there and let's talk about it right now. So under Medicare and under any insurance, you have to see if the type of communication is reimbursable. So historically, we had to meet in person with all of our clients for private insurance, Medicare or Medicaid to be reimbursable. Over time, various insurance companies, including Medicare, have started to recognize that they should reimburse services that are provided through different types of technology. Now, what was announced a couple of weeks ago through Medicare is that for health services that are provided by telephone by physicians under certain circumstances would be reimbursable. And I know that there's been discussions even in recent days, should mental health services via telephone also be reimbursable? So I'm not up to date on what's happening currently today with Medicare, but you may want to find out for sure what is being covered and what's not being covered. If your client is concerned that they would be okay with voice but not with video, there may be ways to use some of your online communication without the video component and still have it to be reimbursable. So you're kind of stuck in a quandary there. Do I provide services when it's not going to be reimbursed? Is it fair to the clients and is it even feasible for the client to pay for services? But for each of the types of insurances that you have to find out whether or not that particular type of communication through technology is being covered. Hopefully there are more and more exceptions to take into account. This is a very urgent situation, but that's definitely a concern that we need to take into account. NASW, ASWB, APA, all of those organizations are advocating, and you may want to participate in that advocacy as well. So if it's a Medicare issue, it's at the federal level. I think if it's a Medicaid issue, a lot of the decisions are actually at the state by state level. Let's go back. Go ahead.
Yeah, we have one note here from someone that says Medicare has released the requirements. An email was sent out to all providers, but I think it's always good for us to confirm that ourselves.
Okay, thank you. Thank you. Yeah, I know in the daily presidential press conferences, they were announcing it, but it wasn't very specific, and I did not receive the letter that you received. But that, if someone has a link for that, maybe we can post that for people as well. Thank you. In terms of the next point, professional competence, a lot of people have been asking me, well, okay, so I can turn on a video conference or I can call someone, but do we know that that's going to be effective? Do we know that I have the competence to be able to do it? It is an emergency situation, so partly we'll be excused for not having the level of confidence that we would love to have at communicating with technology. But as you're working on this, you may want to make some decisions about what types of technology you're more competent at, or are there certain types of training, or are there certain types of practice that you can do in order to increase your competence? So I always like to give the example, before you communicate with a client through video conferencing or even through texting, why don't you have a colleague or two and have some communications with them at the same time, and make sure that you're doing things correctly in terms of the camera positions, that you can hear their voice, they can hear your voice. You've got a backup system. One of the things that we should always have is a backup system. So if you're using video conferencing, maybe telephone is your backup situation, or just letting clients know if the video conferencing technology goes down, wait for 5 minutes and then let's try again. So that at least they know what to do in those types of circumstances. Or if it's a true emergency, let them know that 911 or whatever other emergency organizations will still be there as a backup if your technology is not working. There's lots of ways that we can enhance our competence, getting feedback from our clients, and just trying to do the best that we can, being reflective and learning from each of our experiences. One of the big issues in terms of giving people access to our telephone numbers, our email addresses, and the fact that we may be using our own personal technology is boundary issues, dual relationships, and conflicts of interest. So, you may be used to having a situation where clients come to the office, they don't know your personal phone number, they don't know where you live, they don't know what your house looks like, and then all of a sudden you're welcoming them into many aspects of your personal world. Now, it's still important to maintain appropriate boundaries. So if you are offering clients the ability, for example, to communicate with you via text message or via email, you need to let them know, for example, I will communicate within 24 hours, or from 9 to 5, I will communicate with you within 1 hour, or whatever you think is feasible and appropriate in those circumstances. You may put some automatic messages on your phone, on your email, and whatever other types of technology, that if you're not available, this is the best way to reach you, or this is the person to be your best backup. If you are video conferencing from your home, can you video conference in a way that you are only disclosing the type of information about your home that you think would be appropriate? So having a child in your lap may not really be appropriate during an interview. I can envision a situation where there's no other possibility and you've got a child who needs to be around, but that would be part of the informed consent process. I'm taking care of my child today. I can speak with you right now. If you want to talk to somebody privately without a child, then can we schedule for later in the day, or can I schedule you with somebody else? So we should try to do the best that we can, and hopefully everybody is treating one another with some kindness and patience and with some flexibility, and knowing that we're trying to do the best that we can. But it may be a situation where you have to make different decisions with different clients on a case-by-case basis. If you've got a client who already has some issues with diffuse or inappropriate boundaries, you may have to stick more to setting up more rigid boundaries with clients, even in the way that you're using technology. With other clients, you may know that they are going to be respectful of your boundaries, and it may be better, may be appropriate to be a little bit more open with that. We also should have backups in terms of our own health situation. So if I were to become sick, who would take over for me? Do my clients know who they would contact? Or do I have a professional will, or do I have a professional agreement with other colleagues so that they would be my backup? So that shouldn't just be in a COVID situation, but now, since the level of risk is even much higher for all of us, we should all be thinking about who would be our backup. In agencies, yes, often we've got supervisors and coworkers, and so it's relatively easy for them to step in. But if I'm in private practice, who would be the one who could go into my computer? Who would know my passwords? Who would be able to connect with my clients and offer them services? And would my clients want somebody who doesn't know them to contact them or know about my services? So NASW has a number of materials on their websites around backups and professional wills, or you may want to look online for other examples of how you can set up backup situations and ensure that clients are taken care of, even if you're not able to provide services. In terms of confidentiality and exceptions, so the same types of rules apply. We should provide as much confidentiality and protection of privacy as possible. Note that with technology, if you are communicating with somebody and other people, maybe family members or friends or other people in their house can listen, not only is it not confidential, if a case ever went to court, it might also not be privileged. And so if you and your client are concerned that there may be a case and you could be subpoenaed to court to testify, if you really want it to be considered privileged in court, you have to make sure that your communication with your clients truly is privileged. Make sure it's just one-to-one with them and that other people do not have access to that information. Now, certainly we have the usual exceptions for serious imminent harm to the client or others. Remember, it used to be serious imminent harm or to an identifiable other person. So we've changed that in the 2018 revisions. Note that one of the concerns then is around COVID, and there have been some reports in the media that some people are going around intentionally trying to spread the virus, going to a police station, going to a house of worship, going to people that they don't like, and coughing or spitting. We would have to make a determination, is that a situation of serious imminent harm? And decide whether or not we would need to report that to police or other authorities or potential victims. It may be that the person is not really serious about it, but we may need to do an assessment to see what level of seriousness it is, when they're planning to do it. Is there a way to counsel them out of it? Is there a way to provide some monitoring so that they don't engage in those types of activities? So we could be at the front line of having to deal with some of those situations that we may never have had to deal with in the past. If you have questions about is something reportable or not, and you're in private practice, contact your whoever your clinical consultants or supervisors are. Consult with the social work licensing board. If you're a member of NASW, they're still having online consultations, and you even may want to consult with public health if you think it's a public health issue. Again, Sarah, any questions?
I'm sort of changing topics just slightly, but I've had a couple of people ask for clarification regarding the limitations to registered interns in using telehealth for video therapy sessions. One has commented, my understanding is they can only use telehealth for current clients and cannot develop new client relations via telehealth where licensed counselors can.
Okay, so I got a link to that if they could try to provide it to us, but I don't want to give anybody false information about that. We're having a lot of those situations, not just with our LCSW registrants, but also with students in the field. What can they do and not do? So that would be a state level issue. So we need to contact our state licensing board around that issue. An important question. Anything further?
Let's see, there are a couple of others. Someone has the virus and intentionally coughs on someone and gets them sick. What are the legal implications of that?
So we want to prevent that so that doesn't happen. I guess
Exactly.
I guess the precedent would be, things that would have happened with HIV and with STDs. So it's possible for there to be criminal charges for that, endangering people. And we know that in Tampa there was a preacher who decided to have services this past weekend, and that was considered to be putting people at risk. And that pastor has been charged and may face criminal prosecution because of that. So ideally, we want to prevent that. So it could be a criminal case. It's also possible that the person, if they do contract HIV, that they could also sue the other person for damages, intentional infliction of harm on them. But again, we want to do whatever we can to prevent those situations from from happening. And of course, a lot of it would just be, also in terms of evidence. If only two people are present, how are you going to prove the person coughed, that they coughed intentionally, and that's how you contracted it. So let me get back to talking about some of the things on this slide. If you are not using HIPAA compliant technology to communicate with people, know that there are HIPAA compliant free services available. So doxy.me. You can go to websites like telementalhealth.org and see what they recommend, or HIPAA, they won't specifically recommend these are ones to use or not use. It may be helpful for people to communicate with their colleagues, and some of you may want to share a particular platform if it's one that you want to pay for. Some of you who are doing electronic record keeping, there may already be some video conferencing and texting and other HIPAA compliant technology that's already built into it. So you may want to talk to whoever is providing those services. So for it to be HIPAA compliant, it should have a high level of protection, types of things like dual authentication, strong passwords, encryption, and also there has to be a provider agreement with HIPAA that saying that they will abide by all of the HIPAA. Talked about insurance and reimbursable. One of the questions that sometimes arises is it okay to give people free services or sliding scale? And one of the challenges is that some of our insurance providers tell us that we need to provide the same scale for everybody, and we start charging some people a lower scale, that may affect our reimbursement for the clients that we are charging. So you may want to, again, talk to your insurance companies that your clients are using, and if you think that you need to provide some free services or lower cost services, see if there's a way that you can work it out without violating the terms of your insurance or affecting what you're going to get in terms of reinsurance for other issues. Risk management may be the term of the day that we really have to focus on. Everybody knows what our general obligations are in terms of ethics. We're trying to do the best that we can in less than perfect social, physical, technological, financial environments. And so if we're going to engage in some type of interaction that is riskier than usual, what can we do in order to manage our risks? So one of the things that you can do is you consult with others and document that you've consulted with others. So if you're making a decision about using a type of technology that you've never used before, and it may be a little bit riskier, or a type of intervention that you've never used before, consult with others. Document that you've considered all of these different types of approaches to connecting with your clients and serving them, and why you chose this particular course of action. So document, document, document. Have informed consent with the client. Let them know why it is that you're switching to text-based therapy and how that may be helpful, what some of the risks are, and how you can reduce those risks. Simple things like, after having a conversation through text or video conferencing, closing down the web browser, erasing the history, closing the computer altogether, putting special password protections for each user who's using the computer. All of those things can help to reduce the risks, and letting clients know that there's nothing that's completely risk-free. If we've had people who've broken into FBI, to the leaders of various countries around the world, to financial institutions, to insurance companies, we as private practitioners know that we're not invulnerable, that we're not completely protected in terms of the types of security that we have on our technology, but we're doing the best we can. We're reaching up at least to community standards. This is an emergency situation, so there should be allowance in terms of what our licensing board and federal government and agencies will allow, but we can't just write off everything to emergency. Okay, there's an emergency, so all the rules go out the window. I can do whatever I want. For some of us, we're carrying on practice pretty much as usual. I know that there are people who are working in residential facilities, and they're still working in person. They're trying to do some physical distancing. They may be wearing masks, but they're trying to do as best as possible. I think one of the issues that's come up around masks, I know that some of my students said that they were told they cannot wear masks at their agencies. And I think that's something that needs to be discussed. It's kind of a conflict resolution issue as much as an ethics issue. When we wear masks, historically, it might be seen as distancing ourselves or being offensive to our clients or separating ourselves from our clients. But if I wear a mask, I'm actually protecting my client these days. And we also may want to look, there's different types of masks. And so maybe there's a type of mask where, we're sitting in the same room far enough apart, and maybe I'm wearing a plastic mask, not a paper mask that covers my mouth. So we can see each other, but we're protecting ourselves a little bit more. And we don't have solid information. So if somebody tells me, oh, Barsky, you're crazy, those masks do nothing, or no, everybody should use masks all the time, we don't have perfect information. So we need to use the best information that we have now. So we seem to know that physical distancing works. To some extent, masks work, but also with a limited number of masks, we also have to make sure that the medical workers, the first responders who need them the most, get first access to those masks. But now we're finding out that there's ways that we can make masks that are pretty good at home or even in our agencies, and we may want to encourage that. So as our information changes on what's helpful or not helpful with the virus, we're going to have to adjust to the particular situation. Sarah, do you have any comments that you want to make in addition to what I've said, not just as asking questions, but as I'm talking, is there anything else that comes to your mind? Because I know you're using technology to communicate with clients.
Yes, I am. And, it's been an interesting transition for me as I'm seeing clients because, we talked about the technology, the platforms that are available that are HIPAA compliant. And of course, initially what happened is because of the additional traffic, they all crashed. And I've had to switch from one platform to another. And so it's been interesting to navigate supporting my clients and adjusting to different platforms and that sort of thing, and working through those challenges. One of the things that has come up for me that I've had to carefully think about with each one of my clients is I've got a small handful of them who, due to privacy issues at home, have chosen out of continuing to work until this is over, and balancing between honoring their right to self-determination and not abandoning them has been an interesting thing to navigate. And I found ways through it by asking permission to check in with them from time to time and encouraging them to know that I'm just a phone call away if they need support, but wondered if we could speak a little bit more into that as well.
Yeah, no, I think that's fantastic. There's a lot of people who may not even think to reach out to you. They think that things are closed down, or they don't want to bother you, or maybe they're in their own depression. So I think for us to reach out to clients and try to do it in as sensitive a way as possible. You're doing a lot of great things there. Looking at it from the client's perspective, not just from your perspective and the legal perspective. When something happens like the system of video conferencing that you have, when it goes down, just to be safe, you could document it. So on this day, this went down, and this is why I used this other type of video conferencing technology. And you could document that the client gave you consent to use it, or the client decided, let's put it off until the better technology is back up. I had a student today that I was conversing with, and the student said, I just want to make sure you're not recording this. And that's one of the issues that could come up with clients. Either the social worker or the client may be recording. It's very easy when you're using video conferencing to be able to record. And actually, we should have decided that at the beginning and announced it. Sarah, are we recording this?
We are recording this. I missed the first 7 minutes, but we are now recording this. Yes.
Okay, so we are recording this, and I've given my permission for it to be recorded and to be shared on our website. So I'm all okay with that, and I think Sarah's all okay with that. And as Sarah is reading your questions, we're not going to identify who you are, and so hopefully that's okay with everybody, that because we're not sharing any identifying information with you, that there's nothing that we're sharing that would be risky in terms of your professional reputations or anything else that is personal to you. So we should have talked about that at the beginning. I'm sorry. All right. And the purpose of the recording is to make sure that people who were not able to participate live have access to it afterwards. In terms of what else you were talking about, Sarah, I think also just there's that piece about self-care. I know that some people are working overtime and longer hours and maybe very stressed because of all the things taking care of kids at home. So we still also have to make sure that we're giving time for ourselves so that we'll be able to serve our clients and meet our families' needs and our other obligations that we have. So let's go to a couple of situations. So the first scenario, Hal. Tiana, who's a social worker, has been providing psychotherapy to Hal, who's 86 years old. He has depression. Because of the pandemic, she can no longer see him in person in her office, can't make a home visit. He doesn't have a computer. His only technology is a landline phone. Okay, so Tiana checks with Medicare and is told Medicare does not cover the psychotherapy by phone. And so, as someone said today, Medicare may have actually changed that. So it may be that it is covered. Okay, so we want to just make sure that we truly understand what Medicare's current position is. And also, does it cover the particular type of service to the particular type of service provider? Because I know one of the things that they did first is they said, this is actually the direct quote in what they mailed out. They'll exercise their enforcement discretion and will not impose penalties for non-compliance with regulatory requirements under the HIPAA rules under covered health care providers in connection with good faith provision of telehealth during the COVID nationwide public health emergency. So, you know, it may be okay under HIPAA. It may be that it's okay with Medicare. We still have to make sure that it's okay with the client. So even before I pick up the phone with the client, I may want to think about who else may be at the home. Does he have a spouse or partner or other family members? If they pick up the phone, what do I say to them? And so we may decide, well, this is the only way that I can contact this person, but it's important that I do, particularly because of the situation of depression. If somebody else answers the phone, I may not be able to disclose, or I should not disclose, that I am a social worker, that I'm helping Hal with depression. But I might just ask if they can put Hal on the phone. So again, being conscious of the client's right to confidentiality, the client's right to self-determination, and also reaching out to clients, particularly someone like Hal, who could be at risk and may not be reaching out for help with us. Any additional thoughts, Sarah, that you have on this type of situation?
You fairly well covered that one. It's interesting finding the balance between that privacy piece and making sure that we are still serving our clients in the best way we possibly can.
Right, right. And again, when you're not sure, consult with someone else. There's other people out there who've done more, telehealth and use of technology, and they may have some strategies that you could use as well. And it may be in a certain situation that, you're very concerned about a client who you've not had contact with. Can you call 911 or a health provider service or some other community service that can do just a welfare check just to see if the person is okay or if they need any services? The other thing in retrospect, or maybe for the future for us to have, is always have an emergency contact. And so Hal may have given you permission to speak to an adult child. And if you can't contact them or haven't been able to get in touch with Hal themselves, you might be able to contact the adult child. Not to disclose everything about Hal, but just to see if Hal's okay and if they can check on him and find out if you need to do any further outreach with them or if there's a way that they can connect Hal with you. I know that a lot of the seniors facilities and assisted living facilities are being closed to outside people, but they are allowing in some of the personal aids. And you might get permission for use of the personal aids cell phone. Again, not ideal because it's another person who's involved. But if the client gives you permission to use their aide's cell phone so you can do video conferencing, that may be a good fix. Some people have been asking about consent because they're used to, I hand people a piece of paper, we read it together, we discuss it, and they sign it. Is it okay to do digital informed consent, and what does that mean? So you and your agency need to decide what you're going to accept for consent. So I've seen people who have used cameras for consent. You send somebody a document, they download it, sign it, take a picture of it, and send it back. Is it perfect? Is it HIPAA compliant? Probably not, but you're getting written consent. Is there a better way? Yeah, if you're part of a system like that has online HIPAA compliant record keeping, you can share a document, they can click a couple of buttons, and because they've had to go in with their password, you know that it's that person who's gone in and provided consent, and you've got electronic documentation of that consent. So we need to figure out what's appropriate and what's feasible in the circumstance. In some circumstances, you may have to go back to client provides you with oral consent, and you document it in your records. Not perfect, but better than doing nothing.
So Alan, one of the things that I noticed that I did, and a number of people in some of the Facebook groups I followed did when all of this happened, is I created, with some guidance, a consent form for telehealth. And part of that consent form is collecting information about emergency contacts, the local police department, and their nearest hospital of preference, and authorizing permission to contact those should the need arise. But I thought it was, it felt right to collect that information to know what their preferences were should an emergency arise during the teletherapy sessions.
Fantastic, fantastic. You're doing a number of things that we as social workers should be doing. We social network with each other. We find out what each other's best practices are. What are community practices? How can we raise our level of what we're doing? Sharing resources. The zurinstitute.org, zurinstitute.org. They've got some telemental health suggestions there. APA and NASW have some suggestions there. Do you mind sharing what discussion groups that you've been on that may be helpful to others, or are they closed groups?
They are closed groups, but what I'll do rather than going and looking them up now is when I send a follow-up email out to everyone, I will include them there.
Okay, so. Fantastic. Okay, so people just keep networking with each other. And when you're on those groups, do not share identifying information about clients. Even if you're discussing a client, share some information that's not identifying them specifically, or even get the client's permission if you wanted to ask a question and still avoid specifically identifying them. It's a small world, and I know some people who've worked in rural communities are saying now that people are online, the whole world is a rural community. Somebody across the country may know the person I'm talking about here because they're connected with them on Snapchat or some other social networking program. So this is an interesting one for me in particular because when I worked on the NASW's tech standards and also the NASW's revision of the Code of Ethics, one of the things that we talked about is, should we have a standard that requires people to use work technology for work purposes and not use private technology for work purposes? And we were hoping to encourage people to keep good boundaries between what is work and professional purposes and what are their personal and social lives. But we decided that in the Code of Ethics, there would just be a provision that says we need to be aware of what those issues are, because there are many people who are using their personal cell phones for work purposes, many people who are using their home computers to log into their computer systems at work, or now so many of us are using our personal devices, our phones, our computers, our tablets, and also our internet service providers. So many of us using private tech for work purposes. Some of us are work environments and the laws regulating us may still say that you cannot use private technology or programs for work purposes. So we may still have to comply with that, or we may have to ask for some exceptions to that. But if you are going to use private technology for work purposes, think about what might be some ways that you can reduce some of the risks associated with kind of blurring those private professional boundaries. So for example, if I am taking phone calls on my personal cell phone for work purposes, what I could do is I could set up a separate phone number. And there are now apps that you can download for free that gives you a second phone number. So keep your personal phone number for personal issues and only allow clients and colleagues to call you on your work number for work purposes. If you are sharing devices with family members, again, can you password protect parts of your computer or technology so that other family members can't even inadvertently get into information that may be private? Make sure that you close out of things. And so if my daughter were to open my computer, I wouldn't want them to see who are the last 5 clients that I was speaking with, or who might be on a list of my calendar of who to contact next. So try to keep things as clean as possible and not just erasing information like a voicemail on your phone, but also going into the deleted files or deleted voicemails and delete those that they're deleted permanently from your phone. If you have time, and I know a lot of us don't have time, but I would encourage people to look at the technology standards. They're long, they're detailed, but they may have some very useful information. If you have time, there are books now on digital social work, and you may want to consult with those. Some of us actually have more time now, and so maybe it'll be good bedtime reading, get your mind off of other things and focus on how you can be wizards at using technology and enhancing the lives and mental health and health of the clients that you're serving. So again, where you can keep a separation between private technology and work technology, fantastic. There's also some social justice issues. Why should our work be downloading, their costs on us? Shouldn't our agencies have provided us with all of this technology and all of these mobile devices? Because we're in an emergency situation and everybody's stretched right now, it may or may not be the time to advocate for it. But going forward, we're not always going to be in an emergency, and even if we are always in an emergency, we have to think about social justice. And if I've got students in field placements that are being required to use their phone for work purposes, and they don't have a great data plan, and they're getting all sorts of extra fees charged to them, I should work with their agencies as their field faculty and try to find out ways that students can be reimbursed for those additional costs. Just like if a student was using a car for work, they get reimbursed for gas. How can we reimburse them for the technology that they're providing for folks? In terms of other things like email and social networking, again, you can set up different usernames and passwords for each of those. So you may have a private Facebook page that you use for personal purposes. You may also want to start a psychoeducational group for people that you're serving and provide them with a Facebook page that is completely unrelated to your personal page, not connected at all to it. And you may turn off things like liking, because as soon as you turn on liking on your professional page, people might be then unintentionally self-disclosing, oh, I am a client who has, I don't know, erectile dysfunction, phobias, whatever, and it could be embarrassing to them in their family, in their social community, or even in their workplace. So when you are social networking online with clients, be careful about who may have access to that information and whether clients actually know what type of information is being shared and with whom. In this next situation, Louisa, do you mind reading this one for me?
Sure. So Sammy is an LCSW, and he provides, or she provides Louisa with his personal contact number so that they can conduct their sessions via FaceTime. Louisa calls Sammy in the middle of the night saying that she is having a panic attack.
Okay, great. Thank you. So in this situation, okay, you may have done the best thing possible. You made some phone calls, and ideally with this, not using your personal phone number on your phone, but even though it's your personal, well, here it says personal phone number, so you did give it out. So how do you handle a situation when you've been, contacted by a client with an emergency situation? Well, one, it could be that you don't even bother answering the phone. And so if you had a separate phone number for work and for personal purposes, then you would know if it's a work-related call and maybe decide not to answer it, and hopefully have a voice message on there so that clients would know to call you back at certain hours, or to contact an emergency provider or whoever you suggested as the backup. But let's say that you answer the phone. What do you do? So let me ask you, Sarah, what would you do if somebody found out your phone number? Maybe they found it out because it was online somewhere. You didn't even give it to them. You answered the phone, you didn't know who it was, but it was a client. Would you respond, or would you just tell them to please go away?
Well, if I had answered the phone, I would not just tell them to go away. I would probably work with them, but it's an interesting dilemma in figuring out how to navigate that. My voicemail, both my business number and my personal number, talk about, if this is an emergency, please hang up and call 911. If you want to speak with me, please leave me a message. So both of my numbers say that, just in case.
So you've got good general practice in terms of your policies and general procedures, but sometimes you do your best and still bad stuff happens. And I think you're right that in this situation, if a client is having a panic attack or says that they are, you at least have to talk to them to assess what it is, and you may actually have to be their service provider at that moment. To say to them, call 911, may not really be appropriate there. Now, maybe a client who's not having a panic attack and you need to establish boundaries with them, but at least you have to listen to them, show them some respect, assess what's going on, make a decision about whether you actually counsel them at that time, reschedule with them, and at an appropriate time, figure out how you can reestablish appropriate boundaries with the client, because you don't want this to continue with them. At the same time, our primary obligation is with our client, so we may actually have to deal with it, even if it's in the middle of the night, even if we're groggy, even if we had a few drinks before. We may still have to do the best that we can and document afterwards what happened, how it happened, and what we decided to do in order to deal with the current situation, and also to try to establish appropriate boundaries moving forward.
I think too, Allan, that oftentimes these situations where clients are unintentionally maybe violating some boundaries becomes a fabulous clinical opportunity to work through some of those things with them. It's a great therapeutic opportunity to talk it through when it's an appropriate time to do that during their next session as well.
Excellent, excellent. Yeah, no, we need to, look at things from the client's situation and not make assumptions. And I know a lot of people, have butt dialed me or butt FaceTimes me and all sorts. I had that actually this morning. And so not to make an assumption that they were intentionally violating a boundary, but also being present for them and helping them to better set boundaries in the future. And we ourselves may need to look at how we can avoid, doing something inappropriate, like, pressing reply all rather than pressing reply, or having our phone open in a certain way so that it may be more likely that I unintentionally dial a client, or that somebody in my family uses my phone or technology and unintentionally connects with them. Let's go to another scenario or question from our chat box.
Okay, we have had a couple of people asking about having teletherapy sessions when their children at home. One of them had to do with the child was in the bedroom while the session was happening, and the other one has to do with the difficulty in really working towards treatment goals with someone when the children are in the house. I'm wondering.
Talking about the client's children or the therapist's children?
The client's children. Yeah, okay. And you can best navigate that.
Yeah. So one of the things that I encourage people to think about with technology is what would you do if the technology issue weren't part of the equation? So if you had a client and they had no childcare for their young children and they had to bring them to the office, what would you do there? And so if there are things that you might do, like have games and toys and things to keep them occupied, can they do that? Is there ways that the parents can keep the kids more occupied, and you may even be able to give them some examples of things that they could do? Is there a part of the house that the parent can kind of monitor the kids, but the kids aren't specifically present? So part of it is kind of making the best of what you can. Part of it is deciding with the client, again, according to informed consent. Are you really comfortable having these conversations when your kids might be, hearing and understanding some of what we are saying? Do you want to change the whole focus of what you're talking about and actually bring the kids in? So I was talking to a student this morning, and we're having some role plays online during class. And what I suggested is, why don't you bring your son into the session, and we're going to make a session that involves a child, and that'll be part of our role play. And the student and the child, if they're in agreement with that, we can go ahead with it and make it actually part of the course. So ordinarily, I wouldn't do it, but these are exceptional times, and many of our clients really don't have alternate care, and we can't just say give them to the grandparents, because we're not supposed to expose older people to someone who might have contracted COVID or be a carrier themselves. Okay, any other scenarios that are related or we should discuss now?
A slightly different scenario, we have someone who says she has a number of mandatory clients, and some at this point are not responding to calls or returning contact. And they are, just to use her words, we are looking at the need to document attempted contact in these difficult times and reaching out with written letter. Any other thoughts?
So I think the person who wrote into the chat box was speaking exactly, as they would if there weren't these issues around COVID and technology. What would I do? I try to reach out, try to do the best that I can, document what I'm doing, and then also see, do I need to do something else? So if it's a case referred by a probation officer, do I contact the probation officer, find out from them if there's been some issues? If I have emergency contacts, do I contact any of the emergency contacts? If I think I need to send somebody community-based out to see them, what is it that I would do in those circumstances? And I'm sure that some people may be taking advantage that we're in emergency situations and may not be complying with their court orders, and there may be some more discretion that probation officers and even judges are having during these times. But we don't want to forget that there could be people in need, and we have to reach out and provide them with the best services that we can, document it. You might even do an old-fashioned letter. You put it in the mail today, and it gets there tomorrow or the day after. Okay, let's go on to the next scenario, and then afterwards I'll ask you for some more examples, Sarah. Great situations. Do you want to read it?
So Bob, also an LCSW, sets up a home office. He has 5 kids, 1 dog, 4 cats, 1 husband. He's conducting sessions via Google Hangouts and shares a computer with his family. He's never used video conferencing with clients before. How does he navigate this?
Okay, so some of us are not going to be able to kick out our kids, our dog, our cats, our husband. Some of us can get really creative. And so it actually may be that you might be the one person from your office who gets permission to go to your office to do it because nobody else is present there. And we may see if we're able to get a hold of this virus. There may be some easing up things. So we may try to figure out some ways. And
Hello?
there may be some ways that we can
Nope.
allow some
The
people
girl
to
on cancel her
some-
flight again.
Somebody needs to mute.
Okay, thank you again.
After this, cancel the flight.
Somebody's demonstrating the issue of having 5 kids, a dog. Okay, so we try to do the best that we can. Can we find a space in the house? Can we find a time of day? Can we try to occupy all of these people? And again, is there a way to maybe even bring in the dog or the cat um, or others with permission of the client to make it a productive part of the to make it a productive part of the helping process. But if at all possible, try to get the technology so that like I was saying with myself, I use headphones so that other people can't hear what the client is saying, and I might even decide I'm not going to use the client's name. So even if family or the dog or the cat or whoever hears part of what I'm saying, they never know exactly who it is that I am talking to. So try to create whatever boundaries that you can. Google Hangouts is free and it's easy. Again, we talked about some of the issues around sharing a computer with the family. I even ask my family members not to make use of video streaming or films while I'm doing a very important call because we might have limited capacity. And so if we're all on at the same time, it might slow down my web streaming with my clients. If my video is not really working well with my clients, either because of my connection or their connection, you might want to go to audio only or use video for parts of it that are necessary, and then maybe using video without video for other parts of it. If you've never used video conferencing before, practice it with your kids and your family. And you know what? Your kids may actually be able to teach you some protocols around communicating online. So for example, if you're texting, if you want to emphasize something, don't use all caps. People think that you were screaming at them. If you are using video conferencing, have the lighting in front of you instead of behind you so they're not just seeing this evil shadow cast over in the screen. Think about the clothes that you are wearing. Think about how you can, if you're facilitating a group, how you can structure it so each person gets equal amounts of time and people are not necessarily talking over each other. Make sure people understand how to use the mute buttons and how to share their time with others if you're doing a large group session. So in this next scenario, Samira has been asked by her agency to meet clients with COVID in hospitals to provide service. Samira has a history of lung disease. She wants to help and she really needs a job, but she's scared that she may contract COVID. Social workers are great. If somebody asks them for help, they go out and they provide help. But sometimes we provide help at our own risk. And here in this situation, Samira is at a couple of risks. She's 68, so a lot of the CDC advice is if you're over 60 or over 65 to take extra precautions. And particularly because she has a history of COPD, she has to be extra careful. So I think it would be appropriate for her to talk to her agency, to her supervisors to see, is there somebody else who could provide the services in person? Is there a possibility that she could come to the hospital but not meet directly with clients or patients, and maybe that there are rooms with two-way mirrors and that she's in one room and the clients or others are in a separate room, and try to just get creative with how you can provide services or find somebody else who can provide services in those situations. We need to be, cognizant of all the risks that are involved. And I know that there's even rationing on things like masks and perhaps even the rooms with the two-way mirrors. And we may need to think about who can provide, services without higher risks. I know that one scenario that sometimes happened with home-based care is doctors will call their patients at home, and a nurse or a social worker will be with them at the home, and they can complete part of the assessment in person, and the physician can complete part of the assessment via telemental health. I'm wondering if the same thing could be done within a hospital, that the hospital staff may be present with the client, but maybe their mental health provider, their LCSW, might be able to provide services at a distance from their home office. Any other thoughts that you have on this scenario, Sarah, or any other scenarios that you wanted to raise at this time?
I think you covered that one really well, and I don't have any other scenarios to play out, but a couple of comments that people have shared, kind of backtracking a little bit. One shared that Memorial Health's outpatient mental health is all virtual at this point, and another person shared that what he has done to navigate the telephone issue is that he's using Google Voice and then forwarding that to his personal phone. Just some additional tools.
Excellent. Yeah, and that brings up even an easy solution for people who've got a landline at work. Have people continue to call your landline, but have that forward to your cell phone, so people still don't know your personal number and they're still using your professional number. And then letting clients know that even though you're not in the office, you will be responding to calls on the landline. Okay, so great. Some of these things that seem kind of, intuitive or simple, they may be intuitive or simple to you, but they may be a really big help to somebody else who hasn't really had the experience or hasn't thought about it the same way that you have. So thanks for those.
A couple more notes just came in. One is, do you think it would be appropriate to share specific news with clients due to the constant flow of information and job loss? Would that be in my wheelhouse to provide to my client? I am a mental health therapist. However, my clients are extremely stressed and anxious.
Good, great example. So this is what we might call a boundary crossing rather than a boundary violation. We want to help our clients, and usually what I provide is cognitive behavioral therapy for somebody who is dealing with loss or whatever. And what they're coming up to me with is they've lost a job, they're having difficulty covering rent, etc. And we want to provide them with some information. And it might be information that goes out of our ordinary scope. So it's okay to go beyond our ordinary scope if we're not putting our clients at risk, if we're not creating inappropriate boundaries, if we're, and also if we're doing it with the consent of the client. And so let's say our client doesn't have a job right now. They've been furloughed by Macy's or one of the department stores, but you know of some online jobs that might be okay for them. I would provide them more than one example. I'd say, here's some news that I found out about jobs that may be available from home. Why don't you check them out and decide for yourself? Not recommending that they do it, not telling them which one in particular, but you're providing them with information and allowing them to share. So I'm not sure if that's the type of example that you're talking about, but if you're also talking about, what should we be doing in terms of protecting ourselves from COVID, or if we think that we may have COVID, who should we call first? I think that sort of information, I don't think we should have any problem. I can't give medical advice. I can't tell them, based on what you've told me, you do have COVID or you don't have COVID. But I could say, you know what? It sounds like it's serious enough, and I know that there's a nurses on call program, or I know that most doctors want you to call their office first before coming, because they can tell you where the best place is to go. I wouldn't even necessarily say, go to urgent care rather than go to emergency, or go to your doctor's office versus whatever. I would let them make those decisions themselves, but I would try to empower them by, giving them those types of choices. And if someone says, I think I need to go to emergency, but you're kind of inclined to think, well, it might be a situation for urgent care, you could say, why don't you call the urgent care first, and they can let you know whether it's something that they can handle before you go elsewhere. Do you have any other further thoughts on that scenario? Because it's an important one, Sarah.
Yeah, I think your feedback was great. It was just to not necessarily support and endorse something, but to say, I found this and thought it might be interesting for you. And, if I'm doing that, I always try to look for what I feel like are at least reliable sources of information. There's so much stuff floating around out there. Just trying to do a little bit of verifying, also allow my client to make their own decisions on things as well.
I know that here in Broward County, the school board has provided a lot of the school board has provided a lot of computers to people, because a lot of families cannot afford those computers themselves. Well, many of our clients can't afford. And so is there a way for us to get donors to provide tablets or computers or something else so that they at least have access to the services. What are the strengths and limitations of existing and proposed policies? So here with Medicare, we're going to have to see is the Medicare allowing all LCSWs only, or will it allow our registered interns to bill? Are there ways that we can advocate for further changes? And as the cycle of the pandemic changes, as we ease out of the pandemic, what further types of changes do we want to see? Our new normal may be, part of the normal for a long time to come, or it may continue to evolve, and some of it may revert back to private ways. Think about various types of policies that are being promoted in our communities. Some communities have got stricter lockdown policies. Some are still allowing more workplaces to be open, and social workers should be part of that advocacy process on behalf of our clients, and especially on behalf of the most vulnerable people in society. Another thing that I know that FAU has been doing and other organizations have been doing is they've been opening up fundraising to help our students or to help particular populations, especially for people who have lost jobs or who have been furloughed. So I think we may want to look at who some of those sources are and make sure that the money that we are giving is actually going to the people who are having the greatest needs. Any suggestions, Sarah, that you have in terms of where we could be looking at? All right. Okay.
I've noticed actually that on one of the Facebook groups I'm a part of, there has been a lot of advocacy going on where the leader of the group has been reaching out to agencies to support them in implementing really good policies to support their clients, as well as the professionals working in those agencies. So it's been really interesting to watch how the community has stepped up in all of this as well.
Right, right. And, this is going to change our whole debate on the healthcare issue. And, is our current health system up to snuff, not just for regular periods of time, but for high emergency times? So, this crisis could be an opportunity for us to make major changes moving forward to make sure that the most vulnerable are protected in terms of jobs, in terms of access to healthcare, and in terms of access to mental health services. So, lots of challenges, but also things that we can look into a medium or a longer term and advocate for something better. The next one, assume you live in an area where services are being completely overwhelmed due to the COVID-19 pandemic. Sometimes we can't serve everyone. We've got so many people coming in with anxiety or depression or illness or whatever. So what are the criteria that we use to triage? Now, we know that, typically when we're talking about physical medical issues, our medical professionals know how to triage. If there is a situation where no matter what type of services we provide, what type of medical intervention we provide, the attempt is going to be futile. We're not going to be able to save the person. There are also situations where, the person isn't in urgent need. So we focus on, let's provide our services to those who have an urgent need, but also who will be able to benefit from the services that we are providing. And we may need to make some of those choices ourselves. So if we're being overwhelmed or our agencies are being overwhelmed, who are the people that are in high need and urgent need that we can provide services and it will make a difference? Who may we need to turn away? And it's a terrible thing to turn away, but I guess turn away could be not, abandoning, but is there at least some sort of support or some type of referral to informal supports that we could do? And then are there some clients that we need to ask, hey, can we reschedule our appointment from this week to next week? Or can I provide you with some online services that might help you? And let's try to pick up on this as soon as I'm able to get back to you. So we never like to turn away clients. We're not supposed to abandon our clients, but there may be situations where we have to make very difficult choices. The other thing is not always think about, dividing up the pie, but how can we increase the size of the pie? So how can we increase our social work capacity? So in some situations, you may decide, you know what, working with everyone one-to-one is not as efficient as using groups. And as I'm getting better with online video conferences, maybe I can do an online video group. And so learn about that, and maybe you can provide services in a group format. There may be things that you can do online that you've never really envisioned online before. Maybe as simple as asking the client, is it okay if I send you the intake form in advance? Please complete the intake form in advance, send it to me, and then when we get to our joint session, we'll be able to pick up from there and work together on it. Maybe you can talk some of your friends who have decided to retire, to come out of retirement and help out for a bit. Maybe right now, because New York is being overwhelmed right now, maybe some of our LCSWs want to contact their licensing board and say, hey, would it be okay? Is there a way for me to get authorized to provide services for trauma or whatever else is happening in New York these days? I know that when we were having the issues around the shooting at Stoneman Douglas, there were people who were here on vacation who got permission to provide trauma-related therapy to some of the people because our services were being overwhelmed at the time. Make sure that you're not isolating, that you're reaching out for help. You may not be sure about what to do or how to handle a situation. Situation may be new to you. Contact your typical consultants and supervisors and colleagues. Reach out to some of the people who have done this more often. Try to identify what sort of groups there may be online that can provide some support. And in the tougher cases, you're conflicted about what to do. It may be a situation that you need to reach out to an attorney, a supervisor, an ethicist, the consulting that NASW or perhaps some of you are part of other organizations and they provide consulting as well. It's okay to be afraid and uncertain, validate those feelings. We're all in times of uncertainty. We've all got some fears, and part of being courageous is acknowledging those fears and those vulnerability. I guess I'm sounding a little bit like Brene Brown, and if you need a good pep talk, I encourage you to listen to Brene Brown again and hear some of her wise words about how it's important to be vulnerable as we are courageous. So cultivate your resilience, get good sleep, nutrition, exercise, maintain your physical distancing, but also maintain your social connections with people. Find balance in your life between work, fun, family. Find meaning in the work that you are doing. Don't be afraid to reach out to folks. Even though we are the helpers, it's important for us to know when to reach out for help, when to get different types of help for moral support and even our own mental health support. Heroes are people who reach out for help. Smart people are people who reach out for help. We don't know everything ourselves. We do need to rely on others. Ethics is a team sport. Sometimes we need to use those things that AA tells us, like one day at a time. It may seem overwhelming, but how am I going to get through this video conference this afternoon? How am I going to get through the next day of all of these clients or all of my Medicare and Medicaid concerns? Maintain that positive mind frame. Use all of those strengths perspectives that we use with our clients, good self-talk, and find meaning in these challenging times. It's not bad times just now, it's also times for creativity, for courage, and for promoting social justice in ways that maybe we never even saw possible before. There may be some really great opportunities to go above and beyond just serving one client at a time and making some community differences. So thank you very much for all of the time that you've put into this ethics presentation today. We look forward to your feedback, and I'll turn it over to Sarah for the wrap up.
Allan, thank you so much for putting this together for us today. I hope that it's helped all of you. I appreciate all of you for joining us and contributing so much to the conversation about how we can best serve our clients. This is a very difficult time for us. Hopefully the discussion has offered you some clarity in how to address these challenges. Okay.
All right. Thank you so much. Bye, everybody.
Thank you. If you enjoyed today's presentation, you might be interested in our upcoming workshops, and they have all been moved to an online platform to honor social distancing guidelines. and to hopefully provide the richest learning we can have. You see now on your screen a website to see all of the possible workshops that are coming. If we can support you with any additional trainings on specific topics, please feel free to email me or call me. We will email you the link to today's recording of the webinar as soon as it's available, as well as posted on our social media accounts. And thank you again so much for your participation and for your service to our community. We hope we get to see you in person soon, very soon, as soon as we can safely do so. And have a wonderful rest of your day.